Hi, welcome to our show, Let's Talk, and for the other episode. And again, we would like to thank you for, watching us from time to time. We are doing all these shows and classes. So again, I have a special guest, Miss Geraldine Castillo, and she owns. How many homes do you have, Miss
Three?
Geraldine?
Yeah, three.
Okay, so Miss Geraldine has three homes. They're all in
Chandler.
Chandler. Okay. The topic that we're going to be talking about today is to like a prevention of the COVID-19 in the facility. Okay, Miss Geraldine, having these three homes.
Yes.
Okay, how is it going? Are you guys being affected by this COVID-19? Your census is still the same?
Yes, we're still the same. We just have one that just passed away, but it's not COVID related.
Okay.
It's just because she's under hospice and she just had to decline.
Oh, okay, so
Yes.
that's good. So, well, it's not good that they're
Yeah, yeah, yeah.
declining, but what I'm saying that it's not associated with the COVID-19.
Yes.
So, with this COVID-19 being a pandemic and is still ongoing, how do you prevent this COVID-19 into your facility? Are you guys doing any protocol?
Yes, we do. We have everyone that comes and visit
Mm-hmm.
or come and do any kind of like therapy or home health or
Those
hospice.
essentials. Those
Yes,
essentials.
those essentials. We have an emergency form that needs to be
Filled out.
and the caregiver does all the questioning.
Mm-hmm. And do you guys check their temperature when
Yes,
they're coming
we
in?
do have that. Yes, that's mandatory.
Okay.
That's and then it's on the form as well.
Okay, so that's good. Last week we talked about the inspections, about the surveyors coming into the
Yes.
facility, and before they used to stay for 4 hours to up to 8 hours, right?
That's correct.
Right now they can only stay up to probably maximum 45 minutes, and they
Yes,
are
correct.
looking at the physical environment of the
Correct.
facility.
Yes.
So we were talking about you have to treat them also as an individual, so
Mhm.
make sure that you have to check their
Temperature. Yes.
any protocol,
Yes.
right?
All same as any guest that coming in.
Yes. Okay, so that's good.
Mhm.
Because again, it's mandated by the Department of Health
Yes, that's
Services
correct.
that every single person comes into your facility, coming and going.
That's correct.
You have to have the protocol first. You have to check, and you have a login for them
That's
to sign
correct.
in.
Yes.
Okay. Do you have also sanitizers?
Oh yes, and then we offer also a mask in case they don't wear a mask
Okay.
before entering. Make sure we give them one.
Okay, so that's good. I can see. I know it's kind of hard for us, and especially me when I'm talking, having this. That's why I have these face shields. If I'm by myself, of course, I don't have anything at all with me. But
Yes.
this one, you mentioned that you are providing them face shields,
Yes,
right?
yes.
How about your residents?
Our residents is the same way. They have to wear one if they have a visitor.
Okay, but
It can
how
be-
about if they're alone? Because how many you're licensed for 5 in case you have 5 residents in the home.
Yes.
Do they normally stay in their room, or do they still have to come out to eat and do activities in the living room?
Yeah. Some of them they stay in the room,
Okay.
and then some of them they come out and eat in the dining table.
But make sure that they have like 6 feet
Yes,
social
yes,
distancing,
yes.
right?
And same if they're watching TV together, yeah, they
Make
also
sure.
have the 6 feet distance.
Okay, so
Yes.
very good. And also we were talking about like right now, these face shields. I think I find it very, very convenient.
Correct.
Especially if you're having difficulty in breathing.
Mhm.
So I think, with you guys dealing with this elderly, you can figure out which one that's having difficulty in breathing, which one that's having difficulty in wearing a mask, especially this one or the cloth ones, right? So probably this one is another alternative
That's correct.
for you guys to invest, right? To have your residents protecting themselves to prevent the spread of COVID-19.
Very good
How
idea.
about if you have some essential workers like the hospice that they're checking the end of life residents, like what you have said you had one. When they're coming in, do you keep them in one isolated place?
Yeah, pretty much they're inside their room,
Mm-hmm. But
Yeah.
when the visitors coming in, do they have to come all the way to their room, or what? Or they just have to you set up one table for them to sit down, or the hospice, they have to go to the room.
Yes, yes,
Oh,
they go
okay.
straight there, and then that's pretty much, they just hang out there, and sometimes, yeah, and then go to the bathroom if they need to give a shower.
So they need to wash their hands
Yes,
also.
yes, it's still they follow the the
protocol.
protocol,
Okay, so
and they're
very
more.
good.
It's very actually their necessity for them,
Okay.
because they're coming and visiting other facility as well,
Okay.
and other residents. So
All right, very good.
yes.
And also one more thing. That's the last thing that I have to ask you about. New admission. Are you stopping or temporarily halting the admission in the facility, or you guys still you open the admission right now?
We open, but with our discretion.
Mhm.
Again, I know sometimes they have uh, referral agency, or sometimes family, they said, oh, he's not COVID positive, but we need
A proof.
documentation, a proof that the resident needs to be negative of COVID before we even do any admission.
Okay.
Before we
So you are
proceed, yes.
requiring that documentations that they are
Yes.
clear from COVID. I think that is a very good
Mhm.
idea. When you guys going to start opening your home to admit new residents, make sure you have that, you
Yes,
know,
yes.
and make sure also you have to do your protocols, checking their
Yes.
assessment by checking their temperature with non-contact
That's right,
thermometer,
yeah.
right?
That's
And
right.
make sure they don't have the fever, they don't have the fever more than 100.4.
That's right.
Okay, and then
Mhm.
make sure that they're not coughing, they don't have any shortness of
That's
breath,
correct, yes.
things like that that you have to look
Mhm.
for.
No
Okay,
fever.
well, very good. Thank you so much, Miss
You're
Geraldine.
welcome.
Again,
Thank you,
she
Miss
has 3
Nor.
homes in the facility, and I'm sorry that I have to sometimes brush, right? But anyway,
No
thank you so
problem. I
much.
love.
Do not wait. Don't go out yet, because I'm going to give you the pointers on how to prevent this COVID-19 to come into your facility. Again, thank you so much for watching. This is Let's Talk.
Thank you.
Hello, assisted living. How are you? Welcome to the other episode of Let's Talk. We're glad that you're there to listen and get some more information about the topic that we're going to be talking about today. This is all about manage COVID 19, prevent the spread of COVID 19 within your facility. Okay? These are the long term care and other residential facility guidance. Again, if there's a question, you can always go to pandemicflu.gov. All right? So today, the topic that we're going to be sharing with you is how to manage to prevent the spread of COVID-19 within your facility. And these are the guidelines that is being implemented by the Department of Health Services. As you guys can, I'm sure you guys received a lot of information from the Department of Health Services, and I resend it to all our members towards the end of July. And you were also instructed, if you want to participate for the free COVID test, you have to get the survey, and that will get you there. Now, we have a lot of care home owners who are also asking what is next. Okay, what's next after the free COVID-19 testing has been implemented? All right, and these are the things that we're going to be talking about. All right. So eventually, this guidance, we have at least 16 guidance that we discussed today. Number one, the signs and symptoms. Number two, risk factors. Number three, identify plans and resources. Number four, assessing cleaning and access to hand hygiene. Number five, implement visitors restrictions. Number six, screen health providers. Number seven, how to screen residents. Number eight, educate healthcare providers. Number nine, educate residents. Number 10, contact your local health department to coordinate testings. Report positive cases to your local health department. That's our number 11. Number 12, response to newly identified cases. 13, strategies to prevent spread. 14, optimize PPE and assess supply. 15, release from isolation and quarantine guidance. Number 16, contact your local health department about staffing concerns. Okay. And again, this one, you already received the information, but we're just going to reiterate today and discuss in case you guys have some questions. All right? And mostly, of course, as I have told you a while ago, recommended by Arizona Department of Health Services. So this documentation serves as a guidance to long-term care facilities, which you call it LTCF, to implement best practices for the prevention, detection, and infection control necessary to contain the spread of COVID-19 within your facility. Okay, number one, signs and symptoms. It takes between 2 to 14 days after exposure for symptoms of COVID-19 to develop. Okay, and median is about 4 days. And these are the common symptoms that includes fever more than 100.4 degrees Fahrenheit or 38 degrees centigrade. If the symptoms is they're going to have cough, sore throat, shortness of breath, muscle aches, fatigue. Less common symptoms are the sputum production, headaches, diarrhea, and in older adults, initial symptoms may be mild and fever might be absent. So those are the signs and symptoms. Number two, what are the risk factors? Based on what we know, those at high risk for severe illness from COVID-19 are the following: people who live in a long-term care facility, people 65 years of age and older, people of all ages who have underlying medical condition, particularly when the underlying medical conditions are not well controlled. COVID-19 spreads easily in the LTCF population and outcome can be severe. Rates of pneumonia and death are increased in this population as compared to the general population. COVID-19 infected staff and visitors are the most likely sources of introduction into facility. We're going to be talking about this later on. There is increasing evidence that asymptomatic individuals may spread COVID-19 up to 48 hours prior to symptom onset. As you guys know, we've been tackling this type of educations from the get-go, so you guys just have to look for our shows from the past, okay? You can always look for the Assisted Living Training School on our Facebook, and you're going to check all those topics, all right? How to prepare for COVID-19. Okay, these are the prevention, the introduction of COVID-19 into your facility. Identify plans and resources. Okay, these identify plans and resources, we are going to be talking to them sometime next week. Okay, we're just going to give you the overview today. Review and update your pandemic influenza preparedness plans. The same planning applies to COVID-19. So again, if you don't have your plan, there's a template that can be found here, as you guys can see. That's the link that you can go to. Identify public health and professional resources. We are going to provide you the names and the phone numbers of the local health departments, whatever counties you guys live in. All right. Now, these are the identify plans and resources. Identify contacts for local, regional, or state emergency preparedness groups. Identify contacts at local hospitals in preparation for potential need to hospitalize residents or to receive patients discharged from the hospital. If a resident is referred to a hospital, coordinate transport with a hospital, local health department, and medical transport service, emergency medical service, to ensure that the resident can be safely transported and received by the facility. Opening bed capacity in hospitals is vitally important as the outbreak spreads. Long-term care facilities can help by efficiently working to transfer residents to and from healthcare facilities. Receiving and planning for COVID-19 positive patients discharged from the hospital is critical. Facilities should be prepared from an infection control perspective to safely receive and care for these patients. Ensure facility transfer protocols are in place for residents with an acute respiratory illness. Ensure plans in place to track and clear staff to return to work after illness. Ensure plans are in place to address insufficient staffing. Ensure you have a process to rapidly onboard new staff. update staffing ratios based on current resident census and needs. As a contingency, work with your local health department of the Arizona Emergency System for advanced registration of volunteer health professionals. This agency was developed to help out those people who are in need of help when it comes to staffing. Establish contingency plans for resident discharge or transfer in the event the facility has insufficient staffing to safely meet patient care needs. This may include outreach to families, guardians, outlining potential options for discharge home and home care depending on level of patient acuity. Okay, how to assess cleaning and access to hygiene. Ensure access to alcohol-based hand sanitizers with 60 to 95 percent alcohol inside and outside every resident room. So you guys have to invest of these hand sanitizers, okay? Ensure access to alcohol-based sanitizer in other resident and common areas. So aside from the residence room, you have to have also the outside dining hall. If you have extra living room, so everywhere they go, you should be putting together all those hand sanitizers within your facility. Make sure that sinks are well stocked with soap and paper towels for hand washing. Make tissues and face masks available to residents and staff. Okay. Ensure proper cleaning of environmental surfaces. These days, the face shields are very much available. So I think we recommend that the residents will wear that because a lot of them sometimes they cannot wear a face mask because of having difficulty in breathing. Okay, and how to implement visitors restrictions. Okay, so this is very important, especially these days. You know, Arizona is surging the infected people, so make sure you have to implement visitors restrictions. Okay, because of this ease of spread in a long-term care facility setting and the severity of illness that occurs in resident with COVID-19, facilities should restrict visitation. Okay, and this, please see the emergency rules for disease prevention and control, which is R910-121. I think it was created sometime in March this year, 2020. You can restrict all visitors except for compassionate care situation. For example, the hospice, the end of life. Restrict all non-essentials volunteers and staff, including consultants, okay, services. You know, if you have some barbers or pedicurists or anything that comes to your facility which are non-essential, please halt them for a little while. Send letters or emails to families advising them that all visitation is being restricted and explain possible alternative methods for visitations. We already talked about this about the video conferencing. You know, if you guys can invest a tablet for each resident, or you can even ask your family members to provide one for their communication process, you're welcome to do so. You explain actions the facility is taking to protect them and their loved ones. Facilitate remote communication between residents and visitors. We were talking about that a while ago. So that the reason that we're suggesting to have them their own tablets or cell phones so that the infection is not going to be high. And be sure to disinfect, of course, the high touch surface between uses in the event that you are only using one tablet or your own cell phone. Make sure you disinfect that from time to time. Post signs at the entrance to the facility instructing visitors to not enter. Anyone entering the facility should be practicing source control by wearing a face mask or cloth face covering or the face shields that we suggested. Screen compassionate care visitors and essential volunteers for fever and symptoms of respiratory infection. Restrict anyone with fever or symptoms of respiratory infection if they started coughing, having a sore throat, or shortness of breath. And when you check their temperature, it's more than 100 of 100.4. Contact with an individual with COVID-19. Consider having visitor sign visitor logs in case contact tracing becomes not necessary. We tackled this on the last topics that we had about what do you call it, the survey and inspection in your home. Okay, make sure that you have the visitor sign law. You can implement, provide instruction before visitors enter on hand hygiene, limiting surface touch, use a PPE according to current facility policy, and limit their movement and interaction with other in the facility. All right. So eventually, what we're trying to do is to, when you have visitors or they're really, really essentials, you have to limit them going around. Okay. And also suggestion to close the door of your residents' room if they are inside the room. Advise exposed visitors, let's say those people who are in contact with COVID-19 positive residents, unidentified at time of visits, all right, to report any signs and symptoms of acute illness to their healthcare provider for at least 14 days after the last known exposure to residents with COVID-19. Allow entry to only individuals who need entry. Okay, if the people they are entering and they are not, they don't want you to do your protocol, please, by all means, you have the right to ask them to leave if they're not following your protocols. Maintain contact information for residents, family, or next of kin, and continue open communication. How to screen healthcare workers, okay? The healthcare providers, these are the people who are coming in, your CNAs, your doctors, nurses, and different staff, okay, who has something to do with your residents. So you have to begin universal face masks used by all staff when they enter the facility. If face masks are in short supply, they should be prioritized for direct care personnel. Right now, we don't have any more shortage of face coverings. Everybody, they can, you can get them everywhere. You can actively screen all staff for fever and respiratory symptoms before they start. We were talking about that by performing a temperature check, use a non-touch thermometer, all right? As staff also to report and assess for symptoms. We're talking about this feeling feverish, new or changed cough, sore throat, difficulty breathing, or shortness of breath. Instruct staff that if they become ill while working, they should immediately stop working, put on a mask, a face mask, okay? If not wearing, notify their facility supervisor and go home. But you should have to ask your staff to use a face mask all the time, even though they're just going around or things like that. So make sure. So implement a tracking system for clearing staff to return to work after illness. How to screen residents, okay? Screening residents is very, very important. Although they're staying in your facility, that's what you do the assessment as well. Actively screen all residents at least daily at the time of admission for fever and respiratory symptoms. You can do that the same thing as what you're doing with the healthcare providers, okay? You can perform a temperature check, use an untouched thermometer if available, and so forth. All the things that needs to be looking for. Older adults may not show typical symptoms. Fever may be absent. Less common symptoms include new or worsening malaise, new dizziness, or diarrhea. Implementing a tracking system for ill residents. CDC has resources that can assist with tracking infections. Okay. Continue to screening your residents immediately. Isolate resident symptomatic with respiratory illness. They use standard contact and droplet precaution with eye protection when caring for residents with undiagnosed respiratory infection, unless the suspected diagnosis requires airborne precaution like TB, the tuberculosis. Residents should wear a face mask or cloth covering if tolerated, but again, we are suggesting the face shields or use tissue to cover their mouth and nose when staff are in the room and when leaving the room, including the procedure done outside of the facility. Coordinate off-site medical appointment with the off-site medical facility to avoid potential spread of COVID-19. Notify facilities prior to transferring residents with an acute respiratory illness, including suspected or confirmed COVID-19 to a higher level of care. How to educate healthcare providers. Okay, we are going to educate the healthcare providers by to educate all staff on the prevention of respiratory viruses, including COVID-19. Ensure education includes basic hand washing, respiratory hygiene, and implementation of standard contact and droplet precaution with eye protection. Again, the training is very, very important. The proper donning and doffing of personal protective equipment. Consider a dedicated donning doffing observer to monitor, protect, and guide healthcare providers through the protocols of donning and doffing PPE. PPE is protective, personal protective equipment. Always instruct staff to practice physical distancing, maintaining a distance of at least 6 feet from others when in break room or common areas. So please, just keep the distance. Encourage staff to be up to date on vaccination, including their seasonal influenza vaccination. Exclude staff from work if they are symptomatic with respiratory illness. If staff have been tested for COVID-19 and are awaiting result, they should remain under home isolation precaution. Ensure staff monitor all residents for signs and symptoms of new respiratory infection. How about educating residents? Educate all residents on the prevention of respiratory viruses, including COVID-19. Again, same thing with our educating the care home providers. That's including, of course, the 6 feet physical distancing and make sure they're updated on their influenza. You can ask a resident to report and assess for symptoms. If they have new or changed cough, there is a wet cough to dry cough, sore throat, difficulty breathing or shortness of breath, feeling feverish. Explain actions the facility is taking to protect them. You can cancel all group activities, communal dining, and medically necessary trips outside of the facility. Okay? Residents should wear a face mask. We'll talk about that, if tolerated. Okay? Or the face shields that we suggested. How to contact your local health department to coordinate testing. Immediately contact your local health department if a resident meets ensure and symptoms criteria. Your local health department will help assess the situation and provide guidance for further actions. Okay? And of course, as we're talking about, that there was already a couple of commercial lab that the Department of Health Services provided to get your free COVID-19 test. How to report positive cases to your local health department. We do have list of local department information after this slide, and also we provided you a copy of the template letter for your staff in the event that they are classified as COVID-19 positive, and also a letter for your residents. All right. And these are the local health department contacts. As you guys can see, because we are in Maricopa right now, there is the phone number here. But if you are coming from different county, we also list down all the information that you can have to contact in the event that you have a facility residents or the staff after the test they contracted with positive COVID-19. And if these phone numbers are not available, the ADHS has provided a designated number for you to call. All right, it's just right here at the bottom. Okay, and this is the sample letter to the staff in the event that you have those people who are tested positive. And this is sample letter to your residents. All right. Okay, how about what happened how to respond to newly identified cases? Okay, so after the testing, then you found out there's another, you identify newly cases for COVID. What are you gonna do? You prioritize testing for healthcare providers with symptoms consistent with COVID-19. Determine which residents receive direct care from positive HCP. HCP is a healthcare provider and had unprotected exposure to HCP who work with symptoms consistent with COVID-19 or in the 48 hours prior to symptom onset. Residents who are cared for by this HCP should be restricted to their room and be cared for using all recommended COVID-19 PPE until 14 days after last exposure and prioritize for testing if they develop symptoms. Ensure the resident with new onset suspected or confirmed COVID-19 is isolated and cared for using all recommended COVID-19 PPE. Place the resident in a single room if possible. You can designate a COVID-19 care unit for a positive resident. You can transfer confirmed COVID-19 resident to the designated COVID-19 care units regardless of symptoms. Okay. Continue. If roommates of the residents with COVID-19 should be considered exposed and potentially infected, and if at all possible, should not share rooms with other residents unless they remain asymptomatic for COVID-19 for 14 days after their last exposure. Okay? And you can also expose residents may be permitted to share with other exposed residents if the space is not available for them to remain in a single room. The first primary is to keep them alone. Okay? Consider temporarily halting admission. We already talked about that. If you have some newly residents trying to be admitted in your facility, try to suspend that for a while temporarily, okay? At least until the extent of transmission can be clarified and interventions can be implemented. Residents who have tested COVID-19 positive and who have met criteria for discontinuation of isolation precaution can go to a regular unit or regular bedroom. If isolation precaution have been discontinued but the resident with COVID-19 remains symptomatic, that means the persistent symptoms of chronic symptoms above the baseline. They can be housed in a regular unit but should remain in a private room until symptoms resolve or return to baseline. These individuals should remain in their rooms to the extent possible during this time period. How to strategize to prevent spread? Okay, immediately restrict all residents to their rooms. Okay, food service should be provided to their rooms. There's no communal dining room or things like that. You can set up processes to allow remote communication for residents and others. Please consider the mental health of your resident when implementing isolation precaution and recommendations. We tackled that previously, I think three Fridays ago, about the COVID-19 and the mental health. So if you guys, maybe we can redo that again some other time. Have your HCP, which is healthcare provider, wear or recommended PPE. All right. Cohort COVID-19 positive resident by room or isolate to a private room with a bathroom, if it's possible, until they are no longer infectious. COVID-19 positive residents should be on standard contact and droplet precautions with eye protection throughout their entire infection period. Identify staff to care for COVID-19 positive residents and provide infection control training. Assign dedicated resident care equipment to the cohort unit. Cleaning and disinfection of shared equipment should be performed between residents, okay? But if you can, if it's possible, make sure that the residents, they have their own equipment. So when you're taking the vitals and things like that. Perform appropriate monitoring of all residents at least 3 times daily to quickly identify residents, okay? Notify the receiving facility or EMS or transport service personnel and the local health department prior to transferring a resident in an acute respiratory illness, including suspected or confirmed COVID-19 to a higher level of care. Develop criteria for closing units or the facility to new admission. We'll talk about that to kind of suspend your new admission. Create a plan for cohorting residents with symptoms of respiratory infection, including dedicated HCP to work only on special units. Okay. And how to optimize PPE and assess supply. Considering designated HCP to steward PPE supplies and encourage appropriate use. Make PPE accessible outside of the resident room and in the resident care areas. Implement PPE preserving strategies. You can prioritize gowns for aerosol generating procedure, care activities where splashes and sprays are anticipated, and high contact resident care activities. That's including dressing, bathing, showering, transferring, providing hygiene, changing linens, changing briefs or assisted with toileting, device care or use, and wound care. Okay? And start extended use of eye and face protection, which is again the face shield is recommended. HCP removes only gloves and gown if used and performs hand hygiene between patients while continuing to wear the same eye protection and respirator face mask. Again, do not touch your eye. Okay? Remove eye protection and the respirator or face mask and perform hand hygiene if they become damaged or soiled or when leaving the unit. If your facility is concerned about a potential or imminent shortage of PPE, notify your local health department of the shortage, including your current supply. So again, Department of Health Services are trying to help out in the best way they can. They started a program with this PPEs, or if you're short of staff. How to release from isolation and quarantine guidance. So if you have a resident that are ready to be released from quarantine, COVID-19 positive residents or staff are considered infectious 48 hours prior to symptom onset. That was the date of first positive test if asymptomatic until meeting release from isolation criteria. Okay? There's a release form that you can find to those information that you receive from the Department of Health Services. So utilize that release from isolation guidance form. How to contact your health departments about the staffing concern. Remember we were talking about this one. You can contact, I think this program, I don't know if it's being implemented yet, but if staffing needs are not being met due to an outbreak in the facility, let's notify our health department, which is Maricopa County, because we are in Maricopa, 602-506-6767. If this one is not available or it's always busy, you can also call the Arizona Department of Health Services 480-303-1191. So eventually, these are the topics that we shared it to you guys, that we're just hoping that it will help you to implement how to prevent the infection diseases for COVID-19 in your facility. Again, thank you so much, and we're going to be seeing you again sometime next week, and we're going to be talking about a lot of stuff, pertaining the COVID-19. Again, thank you so much, and we'll see you soon. Thank you for watching.